अस्सलाम वालेकुम लेडीज़ एंड जेंटलमैन, आप देख रहे हैं UMT TV एंड वेलकम टू प्रोग्राम हेल्थ मैटर्स। मैं हूं आपकी होस्ट अरसला शुएब। जैसा कि आपको पता है कि हम इस प्रोग्राम में इंसानी सेहत के बारे में बात करते हैं कि हम ऐसे कौन से स्टेप्स, कौन सी हैबिट्स, कौन सी डिफरेंट चीज़ें अपना सकते हैं जिसके ज़रिए हम अपनी हेल्थ को बेहतर कर सकें, हम अपनी लाइफ एक बेटर क्वालिटी के साथ गुजार सकें। आज इसी चीज़ के लिए मेरे साथ मौजूद हैं डॉक्टर जावेद हयात खान। आइए उनसे बात करते हैं, उनके एक्सपीरियंस, उनकी नॉलेज से फ़ायदा लेते हैं। अस्सलाम वालेकुम सर।
Walaikum assalam.
First of all, thank you so much
Thank you
for
very
being
much.
here. It's
Thank you.
amazing to have you. And ladies and gentlemen, आपको बताते चलें कि डॉक्टर जावेद के पास about 40 years of experience. He is a very learned and very informed man that we have today. It's an honor, sir.
Thank you.
Sir, kicking off with a bang, I would say कि हम directly बात करते हैं कि in my opinion, that's I think the concern, हमारी pollution दिन ब दिन इंक्रीज करती जा रही है. Air pollution especially. Lahore was, I think, called to be one of the world's top 5 most polluted cities when it came to the air pollution index. How does it affect people's health? The general public living here.
Thank you very much for inviting me. It's really clear. Secondly, it's a very important subject you have brought up. We are we compete with India daily. Either they are number one or we are number one. We are just not in top, we are on the top in the world in terms of pollution. And it's getting worse. And it's getting worse. We are approaching the season of pollution.
Yeah.
Starting from October onwards, we will be in that period when there will be a lot of pollution. और उससे पहले लोगों को हमेशा बताया जाता है कि इसकी पोल्यूशन क्यों होती है, उसके असबाब क्या हैं और उसका आप पे असर क्या होता है. These are two things which are very, very important. From a medical point of view, I will just focus on the health ill effects of the pollution. पहली बात तो ये कि पोल्यूशन है क्या, कि लोगों को ये मालूम होना चाहिए कि पोल्यूशन क्या है और किस वजह से पैदा होती है. Then we will एक लफ्ज़ आप सुनेंगी, स्मॉग.
जी.
Smog is a combination of fog and smoke. Right. That's where the word came in at that period. इसे smog कहा गया. और लाहौर में भी smog की बात होती है, pollution की बात जनरली नहीं की जाती. Lahore is always staying in unhealthy part except during the rainy season.
Right.
जब बारिशें होती हैं तो आपको आसमान भी नज़र आता है, आपको तारे भी नज़र आते हैं. Just for 2 months, July and August. Rest of the years, 10 months, we have that air pollution. So we are continuously affected by this air pollution. Now, what air pollution consists of? EQ index में एक और डिफाइन किया था particulate matter. ये जो पार्टिकल्स हैं, छोटे छोटे ज़र्रे जिसे कहा जाता है, वो ज़र्रे हैं जो आप इनहेल कर रहे हैं, उसके साइज़ की बात होती है. 2.5 माइक्रोन की बात की जाती है. जो बड़े साइज़ का ज़र्रा है, लार्जर देन 10 माइक्रोन, वो आपके इस स्टक्स इन योर नोज और अपर एरियाज. जो 2.5 to 5 माइक्रोन जो उससे दरमियाने साइज़ का है, वो आपके जो सांस की नाली है वहाँ पे चला जाता है. जो उससे छोटा है वो पूरी बॉडी के अंदर चला जाता है. तो ये तो हैं वो कंपोनेंट. फिर उसके अंदर क्या गैसें होती हैं, उसके अंदर काफ़ी गैसेस होती हैं, डस्ट पार्टिकल होते हैं, डीजल है हमारे यहाँ, वो भी जाता है, वो सारी चीज़ें. इधर आपको मैं थोड़ा सा एक तरफ लेके जाता हूँ तो आपको लोगों को एहसास हो कि जब हम सांस लेते हैं, हर सांस आप जो सांस ले रही हैं, आपके कम से कम 250 cc हवा आपके अंदर जा रही है और बाहर निकल रही है. और 1 मिनट में आप 12 से 16 दफ़ा सांस लेते हैं, तो 1 मिनट में कितनी हवा आपके अंदर जाएगी आप कैलकुलेट कर लें. अगर वो हवा जो सांस ले रहे हैं आप, द वन यू आर इनहेलिंग, वो पोल्यूटेंट हो, गंदी हो, how much work your lungs has to do to clean it up, to clear it. Or when the baby is born, And by coincidence, if any one of the parents is a smoker and the child inhales that smoke, the lungs development will be affected. उसके lungs grow नहीं कर पाएंगे normal की तरह. वो कभी भी बड़ा, when he gets older, and if he smokes, he's getting into trouble basically.
He doesn't get a fair chance at it.
He will not have a fair chance at all to compete with anybody else who is living without him. So it starts right from the before the child is born. Early childhood, उसकी development पे इसका effect होता है. As an adult gets into trouble, like one of the things is the asthma, getting into respiratory problems, get into nasal problems, get into the air problems, get in so many things, sinus problems. As you get older, still living in an environment thing, then you get all other cardiac problems and respiratory problems. So throughout life, at every stage, you are affected by this pollution. And there's no denying fact. Simply there's no denying fact. We have a bulk of evidence, scientific evidence. बहुत बड़ा डाटा है जो इसको सपोर्ट कर रहा है.
Right.
आपकी ज़िंदगी 20 महीने कम हो जाती है. It started with this notion that if you are a smoker, you switch to e-cigarettes, then you could quit smoking. Very novel idea, caught on very quickly on one, and you produce all that smoke and electronic. But what happened down the road? What they put inside, जो उसके अंदर डालते हैं solutions में, now that's where the problem arose. उसमें जो solvent डालते हैं, that caused a lot of problems. They start making, even to the sudden death, people have died as well due to it. Yes, it's a fashionable. Trend starts at school. As you mentioned, the age commonly affected is the 15, 16 years. And by 4 or 5 years, they get addicted to nicotine. Because it also contains nicotine. So thing which started as something which will help you from quitting is making you addict to the nicotine. So I think apart from the nicotine and the substances which are in it, which has significant health problem, other issues as well, which is the explosions, they do burst into that. I think one important point is you do know the second-hand smoke, people who are next to you, they are. WAP has third-hand smoke, which is not.
Okay.
It's all the surfaces where you are sitting and you're smoking, and the smoke is going in, landing on the surfaces.
It's transferable from this.
It is. Touch, you inhale, you got it. So it has a third-hand smoke effect. Cigarette does not. It's much better to smoke cigarettes than go to the vape.
Right.
But I'm not endorsing cigarette smoking.
Understood.
Then you have heart problems with that. Pakistan is one of those countries where the people die young due to heart attacks. Pakistan is one of those countries who have a high prevalence of the cancer as well. And asthma and COPD, all those, you name it. Then it causes 11 different kind of cancers. We know that. Everybody knows that. So I think if somebody loves his or her family, then you should think twice. You're not only affecting your health, but you're also causing harm to your loved ones around you. अगर ये fundamental point समझ लेना कि कुरान पे कि आप किसी की जान ना लें, एक कत्ल, नाहक कत्ल इंसानियत के कत्ल के बराबर है, तो ये उसी में शामिल होता है कि आपकी सेकंड हैंड स्मोक की वजह से somebody is affected and dies, so you are responsible. अगर इसको देख लें कि मुझे I have to look after my family, I have to look to loved ones, तो probably they should not smoke. तो बड़ी चांस होता है कि आपको कैंसर नहीं होगा.
Okay, last but never the least, simple advice, a simple message you want to give to people in general, maybe a habit, something you want them to pick up so they can live a healthier life?
Thank you very much. I think in the context of the university, I could say to all the young ones, please avoid smoking. Don't go for the weed. Don't go for the e-cigarettes. They are very harmful to your health. Be a responsible citizen and a member of a civic society. Encourage others for the pollution, to control the pollution. It starts from our home, the pollution, the dust, the way that we clean. We clean from the floor and put up in the air somebody else to inhale. So start from home. Do not contribute towards environmental pollution. Thank you.
Thank you so much, sir. Thank you so much for your
What
time.
a good time.
It was an honor to have you. It was amazing.
Did I pass?
Oh, you most definitely did. और ये थे लेडीज़ एंड जेंटलमैन डॉक्टर खान, जिनसे हमने बात की, बहुत कुछ सीखा उनके एक्सपीरियंस, उनकी इन्फॉर्मेशन से. एंड इट्स क्लियर, हमने समराइज अगर हम करें इस पूरी कॉन्वर्सेशन को, तो नॉइज़ पोल्यूशन एंड स्मोकिंग आर टू थिंग्स कि अगर जिन्हें आप रोक दें तो आप ऐसी बहुत सारी हेल्थ प्रॉब्लम्स को अवॉइड कर सकते हैं जो आप अदरवाइज फेस करेंगे. सो प्लीज़ टेक केयर ऑफ़ योरसेल्फ, टेक केयर ऑफ़ योर लव्ड वंस, प्लीज़ डोंट स्मोक. एंड दैट्स इट. अगर इस तरह के आप मज़ीद इंटरेस्टिंग प्रोग्राम्स देखना चाहते हैं तो आप देखते रहिए UMT TV और मुझे दीजिए इजाज़त. अल्लाह हाफ़िज़.
My name is Sayyid Salman Shah and I am a student of UMT in EMBA program 21